Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Mike Dulin. He is a family physician and healthcare executive. He wrote the KevinMD article, How Advanced Analytics Can Help Social Determinants of Health. Mike, welcome to the show.
Thanks very much, Kevin. I'm really excited to be here. I've been a fan for a long time, so excited to have made it onto the podcast.
Oh, thank you so much for listening all these years. And we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. I have a little bit of an atypical journey into medicine. So I actually started my career as an engineer, and I worked as a data scientist for a firm that manufactured computer chips for a number of years. And I went from that, I didn't have a lot of time to volunteer and do a lot of healthcare work. I went from that directly into medicine. And I was just shocked, in the computer chip manufacturing world, we use data every day to drive improved performance. And this was in the early 90s. And I was really shocked when I went into healthcare that we didn't do the same thing. So that's really been my passion as a healthcare provider over the past 20 plus years, is to try to use data and technology to advance the way that we deliver care, and particularly to make our jobs easier as clinicians.
Over the past year, of course, as physicians, we have been inundated with more and more data. So tell me about the evolution over the last few years, about how that intersection with data and patient care has come to fruition.
Right. Well, I think in the area of my article, I think kind of outlines part of my passion in this domain too, which is the concept of social determinants of health and how we start to understand them and use data to drive around social determinants to drive that improved performance. And when I was training, in addition to not doing a very good job of using data and analytics, we very much didn't understand how social determinants played a role in health outcomes. And now we know, I think over the past decade, our knowledge in this domain has really deepened, where we understand that the majority of health outcomes are actually driven by health behaviors that are influenced by social determinants. So the clinical delivery systems themselves only influence a small fraction of those behaviors. So helping to use data and technology to both unearth and understand those social determinants and bring them forward so that as healthcare providers, we can understand them and make sure that we tailor our interventions, particularly around behavioral interventions, in a way that helps us to improve patient outcomes.
And like you said, you write more about this in your KevinMD article titled How Advanced Analytics Can Help Social Determinants of Health. Now, can you summarize the article and just go beyond what you just said? Give examples and show how these analytics can identify and perhaps help solve some of these social determinants.
Sure. So the article, I really tried to focus around some of the key behaviors that influence or underlie preventable health outcomes. So number one is tobacco use. And I think we've known that for a long time. As providers, we have algorithms in place to help us to understand if a patient smokes or not, and to connect them to intervention. We have lots of different interventions in our pocket, like motivational interviewing and shared decision making, the 5 A's, those types of things. But one of the issues is that the societal pressures trump any of those interventions by far that we have. So the number one lever is actually to do something like increase costs, so increase taxes. The other is to start to think about social behaviors to make it more difficult, I guess, in some ways to smoke in social circumstances. If you have a non-smoking airport or non-smoking park. The same holds true for behaviors underlying obesity. So the ability to exercise and the ability to access healthy foods. And I think maybe this is an area of even more opportunity for us as healthcare providers. Because often we can say, all right, you need to change your behavior. You're developing a chronic disease related to lack of activity or consumption of unhealthy foods. But those changes in behaviors can be extremely difficult for patients, particularly if they live in a food desert or they live in a community where there's no access to parks and those types of things. So understanding that first, and if we try to apply an intervention as a clinician and say, okay, what you need to do is exercise more, here's an exercise prescription, go out and do it. But then the patient doesn't have a safe place where they can go and get exercise, or they're unable to access the healthy foods. It can be, extremely difficult and actually, end up causing, worsening stress and difficulty for that patient rather than helping them to improve their outcomes. And I touched on this to some degree too, but I think these social determinants also play a role in the current pandemic. people use their social circumstances and their social networks to get information. So there may be misinformation, within their social network, and that may underlie some of these behaviors that we're seeing, like vaccine hesitancy or resistance to getting vaccines against COVID, or also an ability to change behavior, social distancing, masking, those types of things because of that misinformation in the social network.
I'm a primary care internal medicine physician, so tell me how I can use, or my team specifically can use, analytics to help change some of my medical decision making or influence what I do in the exam room. Can you give some real world examples or stories?
Part of the idea of kind of this next generation of primary care delivery is based on the idea that you have a team-based care. So it's not just an individual physician providing all of the services, but rather we have a full team that may include a social worker, a pharmacist, others that can help with behavior change to a further extent than us, or a care manager or care navigator. But I think underlying that, you have to have a good analytics system to help you understand who has the ball at what time, how do you work together as a team? How do you interact with the patient? And then the other component of that is, how do you tailor the intervention appropriately for that individual that's coming into the clinic at that time, or needs outreach of some sort? And how do you bring into context these social determinants of health? And the idea and the reason that the analytics are so important is because the data is so complex. And you probably have seen this, Kevin. I got dumped data from like Apple Watches and stuff like that, right? Mm-hmm. And to me, as the physician, I had to be the point of integration, the person that interpreted all that data and brought it together and helped to design a clinical intervention based on it. And if you can imagine, we have all that data, patient-generated data, but now we also have all the social data. The complexity is beyond what an individual or even a team can do. We really need these analytic systems in place to help us understand, what is the most impactful thing we can do, and how can we particularly tailor this behavioral intervention. And I hesitate for a minute, and I'd say I think there's two components of medicine that we need to think about here. There's clinical delivery that needs to be standardized, right? We should do the same things in certain conditions across the board. Preventative care, everyone needs their colonoscopy at a certain age or time. Someone that's admitted to the hospital needs DVT prophylaxis. Those things should be standardized and delivered in the same way across the board to help prevent health disparities. But the flip side of that are these behavioral interventions where we really need to understand the patient's context, where they're coming from, their social circumstances, so that we can appropriately tailor the behavioral interventions in a way that they're more likely to be successful.
Now, you're thinking as part of this team-based approach, which a lot of primary care physicians, frankly, are moving towards, that these interventions are going to be done by members of the team, perhaps social worker, perhaps nurse outreach, and not necessarily in the exam room?
Yeah, I think absolutely. Again, I think the exam room may be designed best for clinical care, and we need to contextualize that in some way. If we were providing clinical care that may not be accessible, like, we're prescribing a medicine that's unaffordable, we need to understand that and pivot to make sure that we provide clinical services that do contextualize some of these social components. Just the clinical delivery itself as well, like transportation barriers can make it extremely hard for people to come in and get services. I used to work at a clinic designed to care for Medicare, Medicaid, and uninsured patients, but the clinic was 2 bus stops away from where most of the patients live. So it became very difficult for them to get into clinical services. So yes, I think that's a key component, is to think through, how do we provide asynchronous care? How do we care for patients that aren't in front of us at that time? How do we reach out into the community and kind of break down this wall of the clinic around us in a way that makes it easier for patients to get care when they need it? And my feeling as a primary care physician is it is vital to get these types of primary care services. And if we just have a 9 to 5, you have to come to my clinic to get those types of services, they are inaccessible for a large component of the population without them going through, these barriers, getting daycare, 2 buses, thinking through, how they get into care. And that is one of the kind of silver linings to the pandemic, is we finally have seen some of these care delivery methods like telehealth, asynchronous care delivery start to get a foothold and take off, and actually to be shown to be effective.
I think one thing that we've seen, especially during the pandemic, is how much staffing can certainly play a role in primary care offices. We have the great resignation, and my own primary care office, we have really a skeleton crew right now, and I think this is replicated in primary care offices across the country. And whenever doctors hear that we need to do more with data, right, it always feels like, oh, we have to do more. Like, how are we going to get the resources to analyze this data? What's the cost impact of something like this? So can you speak about how a typical primary care office can implement some of these advanced analytics, keeping in mind things like cost and staffing?
Yeah, it's tough right now. I don't know that we have the solutions at our fingers now. I think a lot of this is thinking through, how do we have input to these new solutions that need to be developed and implemented? And I agree with you. I think for years what we've done, and so I was one of the optimists. I came from the background of being an engineer. I saw electronic health records as being a major solution to help us to be more efficient and effective and provide higher quality of care. And like yourself, I got to see, go through the tough times of like late night pizza parties, entering clinical data into electronic health records and those types of things. 3 days of training to make the electronic health record work, kind of wrapping the provider's behavior and training us to work around a lot of the limitations in the electronic systems that we're using. And I think we need to change that paradigm, right? We need to think of these tools as ways of making us more effective, making our work easier. And as you mentioned, particularly now, there's so much stress on the healthcare system. There's so much difficulty, and it's really hard work. And the tools need to work with us and make us more effective. And I mentioned before the example of getting all this data in my inbox. You get faxes, you get PDFs emailed to you, you get things that are really the data that's really hard to penetrate and to understand and bring forward and improve clinical effectiveness. But the tools are there. These newer tools, the artificial intelligence, machine learning tools can start to drill in. They can use natural language processing to start to pull out important facts and data. And really, they can be built in a way that helps to make us more effective and efficient. They're not going to replace providers by any means, but they can help to make us more efficient and make our jobs easier. And that's what we should be pushing for now.
We're talking to Mike Dulin. He's a family physician and healthcare executive, and he wrote the KevinMD article, How Advanced Analytics Can Help Social Determinants of Health. Mike, can you give us a roadmap in the next couple of years? How do you expect that intersection between data analytics and primary care to evolve?
Well, I think one of the first things, and we've gotten a lot of good information now about our limitations around data, and particularly in the space of social determinants, and also around some of the tools. And one of my past roles, I helped to implement an AI algorithm in the acute care space to look at readmissions and help improve the way we delivered care in that space. And one of my regrets when I think back on that is, we had a lot of excitement about the tool, but didn't really think through some of the bias in the data itself. And now we have really good publications and knowledge about how data can be biased and how it can be influenced by access to care. And certain groups and populations may have data that's lower quality, may even be incorrect in their medical records. So we need to start to focus there. How do we collect the data in a way that helps to reduce the bias and helps us to really understand the social determinants of health? I think that the second thing is we need to be much more patient-centered, and we need to be transparent with patients and help them to understand how and why we're using the data and give them control over how that data is used. And I think some of the new technologies that are emerging, like blockchain, will allow that to happen. So individuals can have control in terms of where their data is used, how their data is used, and see who's accessing the data over time. And I think a lot of the tools, we see it on the consumer side all the time. We use tools like Amazon and Uber and Facebook that are able to manage huge amounts of data rapidly and provide information that's like tailored to that individual that's using the tool at that time. Those same sorts of tools can be used in healthcare. I think we just need to start to, first understand what the potential biases would be when they're deployed and make sure that we don't replicate interventions that could create worsening disparities in healthcare. and then again, deploy them in a way that's patient-centered and provider-centric, so that we're not retraining our physicians on how to use yet another tool that's layered on all these other tools that we've learned over time. So I think the technology is there. The knowledge about how to deploy it is there. We just need to, be engaged and aware as those things develop over time.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
Yeah, I think the key is that social determinants are extremely important. I think we know that, but taking that extra time to understand social determinants and how they can play a role in outcomes up front can actually save time in the long run. It's kind of like asking that second open-ended question when you engage with patients. Also getting the information about the social determinants can take more time. And again, maybe that's part of a role of one of the team members on the primary care team. I think that AI is here. The tools are here. They're developing. We need to not be scared of them and not think of them as replacements, but rather as tools that help us to become more efficient. As you mentioned, the primary care workforce is stressed. It's under difficulty now. We need to take care of our primary care physicians and make sure that they have the tools that can make them more efficient and allow them to work in the space where they want to work, with engaging patients and improving health outcomes. So I think those are the main takeaways. I guess the last one is we also need to understand drivers of health disparities, and it's extremely important that we not build new tools on top of old systems that have created those health disparities and just make them worse. And I really do worry about that. We've already created systems in place that may worsen the current outcomes that we have. And I think every time we look at outcomes across different groups or populations, we unfortunately see the disparities that exist in the US healthcare system. And we need to create tools that don't augment those in any way, but rather address them and help us to provide more equitable care that improves health outcomes for everybody.
Mike, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks very much, Kevin. I really appreciate the opportunity.